Hi folks, Mayor Tom Koch here to talk a little bit about COVID-19. With me today is our Commissioner of Public Health, Ruth Jones, who's been doing an exceptional job during this crisis with her and her staff, working with all our departments, the general public, as well as all of our medical partners in the community. And Ruth, I appreciate everything. I know you've had your hands full.
Thank you.
I know you were also the liaison between the Department of Public Health at the state level, and there's updates that come down constantly. First of all, what we normally do on this update is to give the new stats, and I know we have some new statistics since yesterday. Maybe
we
can
do.
Talk about those.
We do, sure. So total cases today are 506. Recovered of those total cases, 147 people have recovered, and today, at the end of the day, we've had a total of 34 deaths.
In the last 2 days, the bulk of those deaths have been that nursing home
They
situation.
They have, right, exactly. So it really added to our death total. We went from 14 to, I think, 31.
How do you think we're doing when you look at things in the state and other communities? Are we right in the middle of things?
We're in the surge. We're definitely in the surge as far as the amount of cases coming in.
But per capita, are we right in the ballpark with
yeah,
what we should do for our population?
We might be a little bit higher than Weymouth and Braintree, but population-wise, we're a little bit higher than Weymouth and Braintree.
Much higher than Braintree, actually.
And we are not the highest amount of cases in the state. There are some other areas that are much higher than us. So I think we're doing where we would expect to be doing as far as amount of cases.
Yep. Now I know the president's talking about a phased in 1, 2, 3 different phases recommended to the states to look at as we try to reopen at some point. I know we're a little behind New York and some others, so we won't spend much time today on the reopening or ramping up again, but I know we've issued a new order.
We have.
And that comes along from the guidelines from above. You want to talk a little bit about the whole mask issue, and particularly in retail stores? Sure.
So we've been getting lots of calls from people, am I supposed to wear a mask, am I not supposed to wear a mask? And opinions from people for pro and con on this situation. As you know, Governor Baker recommended that people wear masks when they cannot social distance, and that recommendation has been
examples of that are going to the grocery store.
Right, grocery store, going to
pharmacy.
The pharmacy, the hardware store, if you had to go to a doctor's visit or something like that.
Or if you're on public transportation.
Right, or you're an essential person that has to go to work. So those are the people that really have to abide by the 6-foot distance, but sometimes you can't. If you're on public transportation, you do your best. So the recommendation was to wear masks. And I think it became, because it was a recommendation, a little confusing. We decided to go a little bit further and just make it a health department order and a city order that people who are out in public and cannot keep the 6-foot social distance need to wear a mask. And I want people to just realize that wearing a mask doesn't protect you, it protects the other person. So the rationale, I think, from the beginning, even with Governor Baker, was that there are a lot of people who develop COVID-19 and don't have symptoms. They're asymptomatic. So if everybody wears a mask in these type of situations, we're all protecting each other. I'm wearing a mask, I'm protecting you. You're wearing a mask, you're protecting me.
But there aren't enough masks for everybody, so it doesn't have to be the typical mask. You're talking about other bandanas or things that can be used, right?
It should actually not be a surgical mask or an N95, because those masks are in short supply and should be kept for healthcare workers who really need that extra protection. So what we're recommending is we're not really even calling it a mask, just to cover your nose and your mouth, cover your face, or a face cover. You can take a scarf and just wrap it tightly over your nose so it covers your nose and mouth, and that it's tight under your chin so that there's no gaps in there, and that would be enough protection for you. You talking mine or yours? But yes, anything can do. A scarf, a bandana. We actually have a great video on our website that shows the Surgeon General making a bandana. It's really simple. All you need is a bandana and 2 elastics, and you can make your own masks. The cloth masks are really better for the general public because you can take it home, throw it in the wash machine, dry it, and use it again. You can't do that with paper masks or surgical masks. So Any type of cover would be acceptable going into public places. We have specifications of where you should be wearing it.
Okay. Well, appreciate the update, Ruth.
Thank you.
Just a reminder, folks, that as you're using gloves and masks, please dispose of them properly. We've also had some major issues with our sewer department with both flushing wipes down the drain. That causes the real issues. And the amount of grease getting in the system's causing major backups. So please dispose of your grease differently when you're cooking. We appreciate that. And if you haven't filled out your federal census, please do so. That's important for the city in the future. Any questions? We do have the hotline, 617-376-1288. Until next time, stay safe. God bless.